if going through narcissistic abuse weren't enough, we have another hurdle to overcome as we work to go through our recovery from a toxic relationship. Today at QueenBeing.com, I'm going to share with you exactly why therapists, psychologists, psychiatrists very often don't understand narcissistic abuse and how you can find a therapist who does. Plus, I'll share the opinion and thoughts of Dana Morningstar from Thrive After Abuse, who is also a psychiatric nurse. Let's get started. My name is Angie Atkinson, and on this channel I offer free daily video coaching to help you discover, understand, and overcome narcissistic abuse in toxic relationships. I like to call it toxic relationship rehab. So if that sounds good to you, hit that subscribe button and we'll just get going. So very often when you're dealing with a therapist and you have been through narcissistic abuse or you are going through narcissistic abuse, you find yourself being victim blamed. The therapist often says to you, maybe you just need to change this or that about yourself. There are several reasons that might be happening. And the first and most simple reason is that if you go in, say, for couples therapy, the narcissist appears to be a really great person. They seem balanced and normal and awesome because that's exactly what they want the therapist to see. They want the therapist to see that they're a great person. They're showing their good side, their charming side, or their calm side. They seem likable. And if you have been emotionally abused, which you most likely have if you've been with a narcissist, then chances are that you appear to be a little on edge. You appear to be the problem to someone who doesn't understand the nature of narcissistic relationships. If you think about it, it makes sense. Narcissists tend to have this ability to sort of build up their little harem or their little, circle of supply and fill it up with people who tend to be big supporters of them, who think they could, they hung the moon. So it makes sense. However, it's still incredibly invalidating for you as a survivor. Now, this isn't to say anything negative about psychologists and psychiatrists and therapists, because the fact of the matter is, even the guy who created the list, psychopathy checklist, Dr. Robert Hare, even he admits that sometimes he misses a psychopath. The point is that you can't beat up on the therapist for it, but the other side of this coin is that therapists are very often undereducated about narcissistic personality disorder and the pervasiveness of the abuse. It's very difficult to teach it in the first place because if you haven't experienced it, sometimes it feels almost impossible to see it. I'm going to let you hear what Dana has to say about this based on her own experience in the field. Take a listen.
I needed somebody to kind of help put the pieces together. And for me, really too, the pieces started to come together with hearing terms like projection, gaslighting, the word sociopath, some of these key terms. And again, what was so weird is when all of these pieces were coming together for me, I'd been working as a domestic violence advocate and I was a psychiatric nurse. And so, I understood personality disorders and all of this, but it's one thing to understand it clinically. It's another thing completely to actually live it. When a person in like a clinical setting, when a person comes in and they have a pathological personality disorder, like narcissistic personality disorder or antisocial personality disorder, they present very differently than they do when you're in a relationship with them. Yeah. And so I can see why a lot of clinicians, they don't connect the dots because they're like, well, this person that's a sociopath or, antisocial or what have you, they must have experienced a lot of trauma when they were a child, and they're more known for like being manipulative and kind of driven by like dominance and deceit. But the level of deceit is not something, unless you live it, like you just can't even begin to comprehend just how twisted the mental wiring is with these people. It's like in any other profession, there's 10% that are just absolutely awful, that should probably lose their license. Mm-hmm. There's 10% that are worth their weight in gold. And then there's 80% that fall somewhere in the middle. The conversation about abuse, even when I was working at a domestic violence shelter and, we're learning about abuse, learning about red flags, learning about healing from all of this, there were still major pieces of the conversation that we weren't having with women. It was very much covering the more overt signs of abuse, like jealous, controlling, possessive. You feel fearful, they're dangerous, they have a history of violence, very pushy, intimidating, arrogant, that kind of stuff. But the charm, the Prince Charming side of the thing, too good to be true, feels like a soulmate. The good times are really good. The bad times are really bad. All of that kind of stuff wasn't really taught. And when I was working as a psychiatric nurse, it was really more understanding kind of personality disorders in like a very, very surface kind of way. Like, so you would know, okay, if a person is diagnosed with antisocial personality disorder, that kind of what you could expect. Like you could expect a lot of manipulation and exploitation and a lot of, just pathological lying, basically. And there, of course, like I said, there were, 10%, I would say, of the therapists and the clinicians that I worked with were fantastic, and they could see this stuff for what it was, but the vast majority of them could not. And I'm about halfway through my master's program in counseling, and I dropped out of it about 3 years ago. I had to take a break because I was so frustrated by the lack of information that was out there about this. I just was feeling so re-victimized and just angry. I was just triggered right and left. And I'm like, I need to stop, because this is not what I thought it was going to be. And that was when I really realized that there's the information that needs to be out there is not out there.
Yep.
To the degree that it needs to be.
Absolutely agree. Well, that's what we're doing here, right?
Yeah.
Another reason therapy doesn't always work when you're going through narcissistic abuse recovery is because of the long amount of time that you spent with the narcissist. Very often you kind of become conditioned to behave a certain way, and that is to show only the good things. And whether you admit it or not, you may have trouble actually saying out loud what you're feeling, especially if the narcissist is with you. And very often this causes the therapist or psychologist to take your silence or your lack of admission to mean that what you went through wasn't real or wasn't valid. When, if we're being honest, the silence or the lack of discussion of the abuse is more likely a symptom of the fact that you were abused, because you've been conditioned to behave a certain kind of way around people. And so in order to survive the abuse, you may have had to sort of dissociate and therefore sort of remove yourself emotionally, mentally from the abuse that you were going through, which makes it harder to talk about. And let's be honest, even if you are fully educated about narcissistic abuse, chances are you have a hard time explaining it, because it's possible that you only recently discovered that you had been abused in the first place. Often when physical abuse isn't taking place, we don't even see it as abuse. And this is very common. Even domestic violence shelters, as Dana mentions, are very often not educated, don't understand the depth of the abuse and how painful it can be for a survivor. And if you're going through therapy or trying to go to therapy with a narcissist that you're still involved with, then your trauma bond might be causing you to shut down and not share the information. The trauma bond happens because of your intense emotional experiences with the narcissist, which is also kind of the reason you're addicted to them, but that's a whole other video. But the trauma bond is what causes you to want to protect the narcissist. It's actually pretty similar to Stockholm Syndrome. It's basically the same thing. In my own client roster, I have several psychologists and at least one doctor, maybe two, that have told me they were not educated about narcissistic abuse and narcissistic personality disorder to the extent that they could recognize it even in their own lives. So this is a common issue. Now, I'm going to share with you my best tips on how to find a therapist that understands you and can help you. This is from a previous video, but these are my best tips. Take a look. So the first thing I want to tell you is that research proves that the most effective way to get therapy, the most effective therapy in general, it happens when the relationship between the client and the therapist is comfortable and when the client feels understood by the therapist. So this is especially important for narcissistic abuse survivors because so often we are starved for personal validation. We need to know that they feel us. Feel me? So ideally, we need to schedule an in-person or telephone interview in advance, or if you can't do that, just schedule a single session to evaluate the therapist and whether or not he or she will be a good fit for you, okay? So if you could only ask one question, or you want to sneak around and find out if the therapist knows what you're talking about without actually coming out and saying what you're talking about, you could ask this question. This avoids the more direct approach, and it gives you a quick way to find out if your therapist is familiar with narcissistic abuse recovery and narcissistic personality disorder without being interview style or confrontational. It's a very simple question. Ask the therapist, what is your take on gaslighting, and how would you explain gaslighting to someone who hasn't heard of it before? Why would you ask that question? Well, because the fact of the matter is, I've had a lot of clients tell me that their therapists who weren't competent, according to the clients, in narcissistic abuse recovery, the therapists who would blame the clients for the abuse themselves, call them victim players, stuff like this, those therapists almost always aren't familiar with the term gaslighting, and they don't know what it means. Some would just say, well, what do you mean, gaslighting? Some would say, well, I heard of a movie from the 1940s about gaslighting, or a play, or whatever. But if they're not familiar with the term gaslighting, chances are that they don't know about narcissism. They don't know about narcissistic abuse. They think a narcissist is a selfie taker, arrogant, vain person, which sometimes they might be. But as you and I both know, the main thing about a narcissist, the main problem with a narcissist personality, is the fact that they do not have empathy for other people. It drives everything that is a problem with a narcissist, the lack of empathy, which is especially troubling for people like ourselves who are, what? Most likely empaths. If they don't know about gaslighting, that's a really great sign that they don't know about narcissism and narcissistic abuse. I also suggest, if possible, that you find someone who has at least a little bit of personal experience with emotional abuse. It's not absolutely necessary, because you could also do a combo deal where you get a coach and a therapist. If a therapist has been involved with a narcissist in their life, or if they've experienced emotional abuse in their life, they're going to be more empathetic toward you and probably better at treating you because they've gone through this themselves. If they have, generally they're going to admit to you that they have. Now we're going to jump right into the questions 1 through 10 that you can ask a therapist if you're doing an interview to find out whether or not they're the right therapist for you. Number 1, you could say something like this: I'm hoping to work on narcissistic abuse recovery, recovering from an abusive relationship. Are you familiar with narcissistic personality disorder? And have you helped someone through narcissistic abuse recovery before? How would you go about helping someone who's going through narcissistic abuse recovery? Number 2, regarding your therapy style, do you lean more toward cognitive behavior therapy or digging into the deep psychodynamic root of the problem? If you want to start feeling better by treating symptoms and learning coping techniques, you want the therapist to be more cognitive behavioral therapy based. But if you want to dig in and reach the root of the problem and you're willing to wait for it, well, then you want to dig into a more psychodynamic-based therapy style. You want someone who's going to help you do that. So ideally, you might want both. Maybe you want a program that starts by treating the immediate pain and that leads to digging into the root causes as you go. Or a combined approach, in most cases, would be best for most narcissistic abuse survivors. It's really good for you to understand how you got there so that you don't go there again. But it's also good to have a way to relieve the extreme pain and overwhelm that you feel when you're going through a breakup with a narcissist, right? So here's a tip for you. If it fits into your budget, you could get a narcissistic abuse recovery coach like me, along with a therapist, if you need therapy. Some people find they don't need traditional therapy, but if you want to learn coping techniques and you want to get validation and learn that you're not crazy and you want to work through your issues specifically related to narcissistic abuse, a coach can help you with that. A coach can help you with solutions for moving forward and for feeling better about yourself and your life. A therapist is going to be able to help you kind of dig in way below the surface and figure out, what's your diagnosis or how did you become this way or that way? Do you see what I'm saying? A therapist is going to be able to help you dig more into the depth of it all. So traditional therapy is good. Coaching is good. They can also work together. That's my point. Number 3, are you more directive or are you more of a consultant? Some therapists like to use what they call Gestalt type therapies or Gestalt. I never know how to say that right. It's kind of a really harsh in your face kind of therapy. And the truth is that for most narcissistic abuse survivors, it's not great because it makes us feel overwhelmed. It kind of triggers us about the narcissist because it's a really leading kind of style. You want to know if the therapist is going to lead the sessions with a tight planned structure or if they're going to let you lead with whatever you're dealing with. I personally kind of like the idea of a flexible session for survivors. So when they come into the situation, if they want to talk about a specific thing during a session, that can happen. You might have planned goals for the session, but it's okay to put those on hold if you're dealing with a specific issue. That's how I roll with my coaching sessions. You can ask my clients. Generally, I let them lead the sessions, and if they are ready to dig into a specific course of action, then we do that together. Number 4, ask the therapist, have you ever helped someone like me before? And we kind of talked about that in the first question, but ask specifically here, are you familiar with domestic violence and or emotional abuse in relationships? What would your best piece of advice be for someone recovering from this kind of trauma? Because you'll know the way that they react. You need someone who's compassionate confident when you've been through narcissistic abuse. You can't necessarily have someone who's going to try to push you beyond your comfort. You feel me? Sometimes therapists don't understand the tenderness that we need. They don't understand the extremely raw state of how we feel in that moment of discard, in that moment of being gaslighted, all of these things. Number 5, you might want to find out if they have any support outside of the session. So could you check in by phone? Could you text in between sessions? Things like that may or may not be important to you, but there it is. Number 6, will you give me advice if I ask for it specifically? Because the fact of the matter is, I've actually had people tell me quite often, just the other day in Span, somebody said, well, I asked my therapist for advice and they said they don't give advice. Sometimes you want advice, so just keep it in mind. Number 7, will you give me assignments and or coping techniques I can use between sessions for healing and managing during recovery? I think that's helpful. Number 8, who is your ideal client? Asking who the ideal client is will help you to determine if you fit that profile. That's going to help you to determine if that therapist is a good fit for you. Number 9, is our session completely confidential, or will you disclose details to my employer or my insurance company? Number 10, do you think you can help me? That's a legitimate question. If you've kind of given them a brief overview of your situation, you want to know, can you help me or not? It's important. So once you go through those 10 questions, and I would bring a notebook with you and write down answers things that strike you as interesting or important. And during the interview, I want you to be aware of a few more things. Figure out, how fast do you feel comfortable with that therapist? Is it quick, or does it take a while to get comfortable, or did you ever get comfortable during the interview? The next thing you can note is whether or not you felt rushed. Or were you allowed to continue at a comfortable pace when you were explaining your situation? The next thing you might want to know is, did the therapist get you from the start, or did it take a bunch of different attempts and clarifications in order to get them to see what you were talking about or understand your perspective or the story that you were telling? That's important. Did you understand the therapist's thoughts, the therapist's responses clearly and comfortably, or did you have to keep asking? Was their accent hard to understand, or did you struggle with hearing them even, or was there any discomfort in communication with the therapist and the way they were responding to you? Ask yourself whether you'd feel judged by this person if you told them your darkest secrets, or you'd feel comfortable telling them your darkest secrets. It's important. You need to be completely honest with yourself and your therapist and or coach in any situation. Okay, here's my best tip. My very best tip on how to choose a therapist who's right for you during your narcissistic abuse recovery is this. Go with your gut. Use your intuition. Since you're probably an empath like me, chances are if you pay attention to how the therapist makes you feel, you should feel comfortable, and you should not feel the need to hide. You should not feel the need to cover up who you are in any way from this person. You should not feel judged. You should feel safe on an emotional level with this person. That, my friend, is the bottom line. Make sure that any therapist you go to understands the diagnosis, understands where you're at. Ask them about PTSD and CPTSD. Ask, if you ask them about PTSD and they go, oh, you mean that thing soldiers get? Other people don't get that. That's not the therapist for you, all right? If you ask them about gaslighting and they go, what are you talking about? Or they go, oh, you mean that movie from the 40s? Not the therapist for you. You need to find someone who understands what you're going through and is willing to help you get there, right? To get to the other side so that you can have the life you deserve to have, my friend. All right, that's all I've got for you right now. As always, thank you so much for being a part of my day and a part of my life. And hey, thanks for letting me be a part of yours. Make sure you hit that subscribe button and the bell notification to hear more from Dana and myself in this next coming week, and to be notified each time I upload a new video. I'll see you soon.
It's my mission to teach others what I know to be true. You really can create the life you want. Take care of your body, take care of your soul, nurture the real you, and introduce him or her to the world. Be comfortable in your own skin and in your place in this world. Take your spot, take it now, and the universe will take its cue from you. You feel me? If so, subscribe to my channel. Let's get it done together.